Hi, I'm Kate Ferguson, Editor-in-Chief of Real Health Magazine. Today we have with us Vanessa Williams and Dr. Doris Day, a board-certified dermatologist with a private practice in New York City. The topic of discussion will be Botox Cosmetic treatment. You've used Botox Cosmetic treatment for how long?
When I turned 40, so it's been about 6 years.
Okay. Now, did you consider using anything else when you were considering doing any kind of skin rejuvenation?
I had heard about Botox prior to me turning 40 and didn't necessarily think I needed any kind of transformation, but I wanted to maintain the way I looked. Okay. And that's why I was open to using Botox. And one of my fears was that as an actress I would lose expression. And that's why it's really important to go to a doctor, a dermatologist or a plastic surgeon, a licensed physician to find out how skilled they are and to use their expertise. It's also great to ask questions. When you know somebody who looks really good, ask questions. Do you use Botox? If so, who's your doctor? And that helps because women need to network and not keep everything so secretive.
Yeah. Okay. Now, when you first became aware of the treatment, what kinds of questions did you have about it?
Well, I think the first thing that you think about is botulism, and that it's based on something that could be a disease, and affect you negatively. And once you do your research, and certainly since I've been aware of Allergan and the company, Botox has been used for over 20 years, and it's extremely safe. And I have never had any side effects. And again, I ask questions before you get injected, and I think it's great to do your homework.
Okay. Now, well, when you say injection, people always, they get scared. Exactly what was your experience with the method of administration for the Botox treatment?
Well, Botox is used for these 11 marks right here, which are your frown marks. And even as you age and you see your body and your face kind of live in that area, it could make you look distressed or tired when you're not, when you're feeling fantastic. So what the Botox does in that particular area is relieve that frown look and make you look like you're refreshed. Again, it doesn't freeze your look and make you look like you're a mummy. It refreshes your look, and that's what's important about who administers it and how they do it, okay, and their technique.
All right, now it's a temporary treatment, so how does that work exactly? How long before the effects wear off and you have to go back for another treatment?
The Botox works normally about 3 months, and I use it sparingly because as an actress I have to have some movement, especially in my eyebrows, and it's one of my signature moves on Ugly Betty, so I have to be able to be expressive. It's part of my livelihood. And I make sure that I discuss that with my doctor and say, I want to have some movement, so just make me look refreshed. And that's why you go to the good people. And if you need any kind of guidance to steer you towards the people that are fantastic, that administer Botox, you can go to expresssuccesscampaign.com, and it will bring you to a list of people that are close to you that are all certified and approved by Allergan.
When people think of Botox, sometimes they're a little leery of it. What classification is this particular treatment? Is it a cosmeceutical?
Botox is a purified protein, and it's one of the most powerful, dramatic, non-invasive treatments I have to help my patients look their very best. Botox is a natural molecule that is harvested in a way that is very, very safe, and at the end it's really just a purified protein. It's a drug that when injected in very minute amounts into the specific muscles, specifically the 11s, in what we call the glabellar region, or lines between the eyes, those frown lines that tend to be very negative expressions. It actually relaxes those wrinkles, and we understand down to the molecule how this drug works. And so I can, in a very predictable way, inject it right where I want it to go. I know how long it takes to work, which is really just a few days to begin to see the results. And I know it lasts up to 4 months. So I have a very reliable, reproducible effect that's very, very safe and makes my patients look beautiful.
When people think of an injectable, they're usually concerned about it being painful. Can you tell us how this method of administration, how the patient is going to feel getting an injection of Botox?
One of the most common things my patients tell me after the Botox treatment is done is, "That's all? That's it?" Because they're always surprised at how little it hurt, how fast and easy it was, and that's it. It was done. So it's a few very small injections right into the area where those muscles are.
Okay.
And the needle is so small that it barely makes a hole in the skin, barely punches through the skin. And it really doesn't feel like much, just like a little pinch. I know because I do it for myself too. And after that, you can forget about it. I always tell patients not to tell their friends or anyone they've done it, because in about 2 weeks after the treatment, they'll get the same response every single time. Did you change your hair? Did you go on vacation? What did you do? You just look good. But they can't tell why. They just know that you look better, and they're not sure exactly where that was, because when something negative is removed, nobody notices. You know, when you get braces and you get the braces off, they just see your teeth, but they don't remember that you ever had them, even though you had them all those years. So when you take away something that doesn't belong, people notice that you look better, but they can't remember what it was that you took away to make you look so good. And that's one of the magical sides of Botox for me, and makes it a very rewarding treatment.
Okay, now are there any side effects of Botox that women should be aware of?
With every drug and every treatment, there's always a risk. And that's why it's really important to make sure that the person doing the injection is a trained aesthetic physician, which is a dermatologist or a plastic or reconstructive surgeon. And in that context, there has never been one long-term adverse result for cosmetic use. So when Botox Cosmetic is used in the way that it's been indicated, there has not been one long-term adverse result. So you may have a little bruise at the site, which even that is very rare. Some people may have a headache that evening. Other things that are reported but are very rare, I've never seen it in my practice, are flu-like symptoms. But the most common thing is that the injections are done, you go back to work, back on with your daily activities with no restrictions, and within a few days you start to see the results, and within a few weeks it's at its peak, and it lasts up to 4 months, and you just look better for that amount of time and even beyond.
All right, now are there any best candidates for this treatment, and then maybe perhaps people who really should not use it?
Botox Cosmetic is great for people who have those 11s, those frown lines, and even before those lines are at rest. So it's for dynamic lines, lines that are with movement, but some people have lines with movement that are already starting or already present when they're not moving either. So it's a wrinkle relaxer and oftentimes a wrinkle eraser. It's not for somebody who's pregnant, if someone who has certain neurologic conditions, something like myasthenia gravis, and that's why it's important to have that discussion with your doctor, or if you're allergic to any of the ingredients. But the vast majority of people who come in with whom I have a discussion end up having the Botox treatment and end up being very happy and satisfied and continuing those treatments over time.
Okay, now is the only indication those 11s, or can it be used for, you know, the smile marks or any other wrinkles on the face?
Botox Cosmetic is FDA approved for the 11s, and that's the FDA approval.
This is Kate Ferguson, Editor-in-Chief of Real Health Magazine. Thank you for joining us today, and thanks to Vanessa Williams and Dr. Doris Day. Fascinating discussion on Botox Cosmetic treatment. For more information, don't forget to visit expresssuccesscampaign.com.